Welcome everyone. My name is Corinne and I will be your moderator this evening. I am excited to welcome Dr. Peter Kreimerman, VP and Head of Medical Affairs at Evolus, as our speaker tonight, as he will be discussing how your aesthetic dentistry practice can benefit from offering Jeuveau, the latest FDA-approved neurotoxin. Before we get started, I would like to take a moment to highlight some features that will enhance your viewing experience. To contact Dr. Kreimerman, click the envelope icon under the speaker bio box. If you have a question, please type it into the box labeled "Have a Question," and we will answer them live at the end. And if you would like to receive a complimentary sample, you can request one using the sample request widget on the bottom right-hand side of your screen. And lastly, Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand. Dr. Kreimerman, welcome, and thank you for being with us tonight. I'll pass it on over to you.
Great. Thank you, Corinne. It's great to be here. Can you hear me okay?
Yep.
Okay. Everybody else hear me okay? I'm just joking. I know there's no feedback. All right. Well, thanks again, Corinne, for having me, and thanks for everyone who's in attendance this evening. I know it takes time away from family and work to be here, so I do appreciate it. I very much appreciate the partnership we have here going with Henry Schein. And just a brief about my background again. As Corinne mentioned, I'm a board-certified plastic surgeon. Well, I'm not sure if you mentioned that. I'm head of medical affairs for Evolus. We'll talk a little bit more about the company, where we've been and where we're going. I also run a clinical practice very much based on office type aesthetics and injectables. And then I have a clinical appointment with Campbell University. So again, that's my background, so happy to be here. I will just a couple of housekeeping things. As Corinne mentioned, please feel free to add any questions into the Q&A, and I'll be happy to answer them as we go. Really, the outline of today, it's to introduce the company, our product, which is a neurotoxin, and also provide you a free sample if you should choose one. So to get one, which I don't really see any reason not to. It's talking about something that's worth a significant amount, so why not? And what we're going to do is I'm going to run through some slides, which is really a bit of where our company came from and the toxin market and the aesthetic market. Then we prepared a video, which is about 24 minutes. It's a compilation of a number of things, and it really kind of built for this webinar. And it talks about product info, our FDA studies. We have a nice head-to-head against Botox that'll be highlighted there. Relevant anatomy, which I think is also fun and interesting from kind of a celebrity anatomist that we work with often. It demonstrates it on a cadaver. And then we'll also talk about some on-label injections in a video there as well. And then we'll come back and do a Q&A. So the video is 24 minutes, and then the rest of the hour we'll spend on a Q&A. And also during the video, if you have any questions for that, just type it into the Q&A section, and I'll get to it when we come back. Okay, hope that was clear to everyone. So a little bit about Evolus. So we are a performance beauty company. We have been really focused on the aesthetic space and the non-payer aesthetic space. Our first product, which is really kind of our foundational product, is Jeuveau. It was FDA approved in 2019, and then subsequently has been approved in Canada and also in Europe, which is a market that we're launching into later this year. But for us, the aesthetic market is key, and neurotoxin is foundational. Obviously, everybody knows the name of Botox, and then there's been some other competitors that have come into the market since. We're the first innovation really in that market in about 10 years now. And the other thing that really Evolus focuses on, we very much have a unique digital platform, marketing offers, and other things that really just to make it seamless and frictionless for our customers, which is individuals like yourselves who are in this webinar today. A little bit more about Jeuveau too. Since launch in the last 3 years, and we just celebrated our third anniversary from launch, you could see our sales there in the past 3 years. They've continued to expand year over year. We'll talk a little bit more about the neurotoxin market in general in the U.S., but it's estimated to be about $2 to $3 billion and experiencing significant growth year over year. There's never been a down year. But when we compare ourselves to since in the last 3 years of other aesthetic devices or products that have been launched, we've by far been the most successful, where you can see us all the way on the left with our revenue. And then also successful in the biotech sector. We've all been kind of hit by the stock market as of late. Biotech in general has taken a significant hit. These are the most successful companies in the biotech sector for this year, and you can see we actually lead that as a performer. Our stock has been doing really well, and we're very proud of that. And I think Wall Street is recognizing what we are doing. So a little bit about the history of botulinum toxin, or toxins for short. Fun thing, it was, I think everybody probably is aware that it's a foodborne illness, really from a bacteria derivative found a couple hundred years ago. But then people started experimenting with bacteria, botulinum toxin in the 50s to treat different disorders. And in the 1970s, it received FDA approval, which is a bit more pertinent for us. There's been many approvals in different therapeutic areas throughout the years. But really, for what we're talking about, it started with treatment strabismus, small muscles there, obviously could be safely injected. And then that led to indications such as hemifacial spasms, blepharospasms, so medical indications. And then, lo and behold, people realized, oh, their wrinkles got better too. And so in 2002, Botox was approved for treatment of glabellar frown lines. Since then, there have been, as I mentioned before, some competitors have come into the market. Dysport and Xeomin, they kind of have their own individual characteristics, but really, that's been over 10 years, and there's been no innovation into that market or those products until we've come in about 3 years ago now, but before that, nothing really for 10 years. And you'll kind of see some of the uniqueness of the product as you watch the video. You'll see talk about our manufacturing process, the purity, really like the precision of the product overall. So another fun thing to think about is, okay, how does it tie into you all here on this webinar? So as botulinum toxin, Botox, if you want to use generically, but as I mentioned, there's obviously others in the space, and some of you are familiar with that, some are not. Really kind of started with the core aesthetic physicians, plastic surgeons, dermatologists, facial plastics, oculoplastics were some of the first. And that was about 20 years ago, and then it quickly kind of spread to non-core individuals, meaning physicians like primary care doctors who added it to their existing practice, people who were running wellness clinics who added it to their existing practice, OBGYNs who have a very captive audience of younger females also added it to their practice. And that's continued to evolve over the years with expansion from the non-core physicians to now a significant amount, maybe a dominant amount of individuals injecting neurotoxin now being nurses and mid-levels. And with that, over the years, certainly dentists have also come into that sphere. And in most states, it's compliant for dentists to inject toxin for aesthetic purposes. There certainly has, I'm sure everybody's aware of using it for other indications such as bruxism and TMJ. But certainly, obviously the next frontier and what we're talking about here is on the aesthetic side. So, and then just as I mentioned, I kind of alluded to the aesthetic market in general. Really, toxin is the #1 aesthetic treatment. It's been growing 9 to 10% year over year. It did not get impacted negatively during the 2008 economic downturn, because people would stop getting facelifts, and maybe they would stop getting dental implants, but they didn't want to stop getting their toxin treatments. And so it's grown year over year, 9 to 10%, as I've mentioned, with millennials being kind of the largest growth area. Currently, the market's estimated to be about 2 to 3 billion. That's on the cash pay side, not even talking about the medical side, where there's a fair amount of indications. But we are a aesthetic only focused company, so it allows us to do certain things that honestly the companies that have medical indications can't do. And then the estimate is that the market in 2030 will be upwards of 6 billion, maybe even more. How does it relate to what you all do? As I mentioned, certainly people are familiar with treating bruxism, TMJ, and so on. But there's really, I could probably count about 19 other aesthetic indications the toxin's used for, with the predominant amount of them being in the upper face. But and then when we think about your all market, certainly cosmetic dentistry I know is important. That's been growing. From what I've seen, estimates about 8% year over year. And then we all know that really the insurance-based, both in medical and dental, continues to shrink due to decreased reimbursements. So on that side, we've noted that about 10% of dentists are trained to do neurotoxin, but really actually the percentage of people doing that is lower. So that is a offering that's certainly you can add to your existing patient base, which already is a group that's kind of patient population that's already appearance conscious in general. So with that, I will kind of cue the video in the next portion of our discussion here today. As I mentioned, what we're going to do is we put together this video. It's kind of 5 parts intertwined. And really, this will give you a good idea of the product, our study data, relevant anatomy, how to reconstitute the product, and how to inject it on label. And I say on label because there's many indications for toxin, but there's only really a few that are approved for aesthetic purposes with any company. So a very large proportion of treatments are done in the off-label sphere, I should say. So Corinne, I'm going to cue the video, and then as mentioned before, please feel free to enter any questions in the Q&A, and then when we come back, I'll address those or any other questions you may have.
Hello, friends of Evolus. We're thrilled that you are interested in trialing Jeuveau. Today, I will be reviewing key information related to our company and lead product. The objective of today's presentation is to provide you with a solid clinical foundation for our product in order to maximize your experience with us. Let's get started. Say hello to Jeuveau. It is the first neurotoxin to be approved in the United States in nearly a decade. The last product in the category to receive FDA approval was Xeomin in 2010. What makes Jeuveau unique is that it is the first and only neurotoxin to be dedicated exclusively to aesthetics. This means that Evolus does not plan to pursue therapeutic indications for this product. The result is twofold. The first is a company with a singularity and focus that spends 100% of its time thinking about aesthetic practices like yours. There are no competing businesses within Evolus. The second is with an aesthetic-only indication, Jeuveau is not reimbursed through government healthcare programs, which results in more latitude for Evolus to provide value to practices, which you will see come to life later in this presentation. Jeuveau is manufactured using proprietary high-pure technology in a state-of-the-art FDA-inspected facility, which was purposefully built for Evolus and operates under strict GMP, or Good Manufacturing Process standards. The important thing to note here is that each toxin manufacturer has its own unique and proprietary manufacturing process. There's a saying in our industry that with neuromodulators, your manufacturing process is your product, meaning each company's manufacturing process is their intellectual property. Jeuveau is manufactured using our proprietary high-pure technology, which results in a product with over 95% purity and is the most modern manufacturing process of the currently commercially available neurotoxins in the U.S. Our high-pure manufacturing process results in a unique neurotoxin product, and as a result, Jeuveau units are not interchangeable with other neurotoxins currently available on the market, which is shown on this slide. Each company's unique manufacturing process results in products that are slightly different, either in molecular size, excipients, and/or storage, among other factors. The active portion of the botulinum toxin type A molecule is 150 kilodaltons in size. Jeuveau, Botox Cosmetic, and Dysport have accessory proteins which surround the active portion of the molecule, resulting in a larger molecular size than Xeomin, which does not contain accessory proteins. How the vials are processed can have an impact on the final drug product quality. Jeuveau is manufactured using vacuum drying to optimize the final drug product quality and is a more efficient process for finishing than freeze drying. We will now review the mechanism of action of Jeuveau.
Facial expressions result from contracting muscles beneath the skin. The procerus and corrugator muscles work together to pull downward on the eyebrows and work antagonistically with the frontalis muscle, which elevates the eyebrows. Over time, static glabellar lines can result from a combination of underlying skin changes and high muscle tone in this area from repetitive muscular activation. Jeuveau, probotulinum toxin A, XBFS, is a 900 kilodalton botulinum toxin type A protein containing a neurotoxic light chain and non-toxic accessory proteins. These accessory proteins may protect the light chain from degradation. Jeuveau is manufactured using patented high-pure technology, which results in a drug substance with over 95% purity. Purity impacts the amount of active versus inactive toxin in each vial. Jeuveau is injected directly into the corrugators and procerus muscles, where it exerts its effects to temporarily improve the appearance of the glabellar area. During normal muscle contraction, the central nervous system sends signals down the nerve towards motoneuron synapses at neuromuscular junctions. This signals presynaptic vesicles containing the neurotransmitter acetylcholine to move towards the presynaptic cell membrane. On these vesicles is a protein called synaptobrevin. On the receiving cell membrane are the proteins SNAP25 and syntaxin. These proteins combine to form the snare complex, triggering membrane fusion. Upon fusion, acetylcholine is released from the vesicle, which traverses the synapse and binds nicotinic receptors on skeletal muscle cells, signaling contraction. Jeuveau approaches the neuron membranes, where it binds to specific molecules and proteins and is taken into the neuron. Inside the cell, the L chain is released and is now free in the nerve cell. Once in the cytosol, the L chain cleaves SNAP25, preventing vamp docking, subsequently stopping the degranulation of acetylcholine into the neuromuscular junction. The pull on the above skin layer ceases, resolving the wrinkles directly at the source. Jeuveau's effects wear off when motor neurons sprout new synapses to restore signaling.
Now that we have learned about the product and how it works, let's look further at the clinical data behind Jeuveau. Jeuveau received FDA approval in 2019 for the temporary improvement of moderate to severe glabellar lines in adults. The FDA-approved dose is 20 units, administered via 5 injection sites into the procerus and corrugator muscles. Each Jeuveau vial has an on-label reconstitution volume of 2.5 mLs, resulting in 0.1 mLs or 4 units per injection site. In 2 open-label repeat dose safety studies, patients received an average of 3 treatments in 1 year. Now let's see how to reconstitute and prepare the product for treatment of moderate to severe glabellar lines.
Reconstitution. The following supplies are needed for reconstituting Jeuveau. Jeuveau, supplied as a single-dose 100-unit vial. Alcohol swabs. A 3 cc syringe with a 21 gauge or larger needle. 0.9% preservative-free sodium chloride. Prior to intramuscular injection, reconstitute each vacuum-dried vial of Jeuveau with sterile 0.09% preservative-free sodium chloride. Draw 2.5 milliliters of 0.09% sodium chloride into a 3 cc syringe. Opening the Jeuveau box by pressing in on the Open Here tab located on the side of the box. Remove the cap from the vial. Do not remove the metal ring or rubber stopper from the vial prior to reconstitution, as this will disrupt the vacuum in the vial. A vacuum will pull the diluent into the vial. Do not use the vial if a vacuum is not present. The diluent will be pulled into the vial by the vacuum inside the vial. Gently mix Jeuveau with the saline by rotating the vial. To remove the metal ring on the vial, lift up on the tab and pull. Reconstitution with 2.5 milliliters of 0.9% sodium chloride will yield a reconstituted solution at a concentration of 4 units per 0.1 ml. Dispose of any unused saline. Jeuveau should be administered within 24 hours after reconstitution. During this time, unused reconstituted Jeuveau should be stored in a refrigerator between 2 degrees and 8 degrees Celsius. 36 degrees Fahrenheit to 46 degrees Fahrenheit, in the original carton to protect from light for up to 24 hours until time of use. Do not freeze reconstituted Jeuveau. Jeuveau vials are for single dose only. After reconstitution, Jeuveau should be used for only 1 injection session and for only 1 patient. Discard any remaining solution after administration.
Now that we know how to reconstitute and prepare the product, let's take a look at the key clinical studies supporting the safety and efficacy of Jeuveau. As a part of the Transparency Clinical Program, Evolus conducted 3 phase 3 studies, 2 identical placebo-controlled studies in the U.S. named EV001 and EV002, as well as 1 phase 3 study in Europe and Canada named EVB003. When looking at the demographics of these studies, you can see that there were no significant differences between groups in each of the 001, 002, and 003 studies. One important thing to note is that all 3 studies had a larger proportion of baseline severe patients versus baseline moderate patients. The studies in the Transparency Program included more than 2,100 patients globally. In the U.S. studies, the primary endpoint was a 2-point composite improvement at day 30 on the GLS scale at maximum frown, and in Europe and Canada, the primary endpoint was the proportion of subjects achieving a GLS score of 0 or 1 at maximum frown at day 30 by investigator assessment. Here you can see before and after photographs of a model who was treated with the on-label dose, reconstitution, and injection pattern. As you can see, the results were seen as early as day 2 and were sustained out to day 150. This table captures all adverse events at a rate of greater than or equal to 1%, where the Jeuveau group was higher than placebo. It is important to note here that this is all adverse events, which includes both Jeuveau-related and unrelated adverse events. There were no serious adverse events in either study that was assessed to the study drug. On this slide, we show 4 different exploratory analyses from the EVB003 study with responder rates for Jeuveau versus Botox Cosmetic versus placebo from day 2 to day 150. The top 2 graphs show responder rates from day 2 to day 150 on the GLS scale based off of a greater than or equal to 1 point improvement of GLS at maximum frown based off investigator and subject assessments. The bottom 2 graphs show responder rates from day 2 to day 150 among subjects achieving a rating of improved or much improved corresponding to a 1 or a 2 on the GAIS scale based off of investigator and subject assessments. Overall, Jeuveau was numerically favored in 26 of the 30 exploratory endpoints evaluated in this non-inferiority study. Now, from our clinical trials to your clinical practice, Injection technique will also determine successful outcomes. Precise injection requires a thorough understanding of the functional anatomy and assessment. Let's take a closer look as Dr. Sebastian Cotofana reviews the specific muscles you are targeting.
Hi, my name is Sebastian Cotofana. I'm professor for anatomy, and in the following session, we're going to talk about the muscles responsible for the glabella. The muscles of the glabella are a little bit tricky to understand because they all form a complex, a muscular complex, which also sometimes is referred to as the periorbital muscular complex. The reason for this is because all of the muscles that are located in the periorbital area, they all interact with each other. They all co-influence each other. And this is why when you apply toxins in this area, you need to understand and know your underlying anatomy. Because when you apply your toxins, you need to have a high precision to not cause collateral damage. But what do I mean by collateral damage? It means that when you apply a toxin, the toxin should affect only the muscle of intent and not other muscles. Just the one muscle that you want to target, this muscle you should target as well. So with this, you need to truly understand why precision is important, why anatomical knowledge is important, and also you need to know your toxin. You need to have a toxin with a very tight diffusion radius, which means it does not affect other muscles that you don't want to affect. And when you combine all of this, precision, anatomical knowledge, and the clinical outcome that you want to have, you have the perfect mixture for an excellent clinical outcome. And now let's look a little bit at the underlying musculature in a pre-dissected body donor. Understanding the in-depth anatomy as it underlies and forms the glabellar complex, let's have a look at the pre-dissected body donor, how the underlying anatomy looks like upon pre-dissections. The skin has to be reflected to expose the deeper layers of the underlying muscles. And when the skin is being reflected, immediately the muscles can be exposed. Of course, a layer of subcutaneous fat can be appreciated overlying the frontalis muscle, but upon removal of that fat, as has been performed here in a lateral aspect, we can appreciate how the frontalis muscle interacts with the orbicularis oculi muscle, and in this way can influence the position of the lateral eyebrow. In the medial aspect, the skin and the subcutaneous fat is more glabrous, as can be appreciated here, and no superficial muscle can be appreciated in this respective area. To appreciate, however, the muscles that form the glabellar complex, like the procerus or the corrugator supercilii muscle, a deeper approach has to be performed. To appreciate the relationship with the overlying soft tissues, a cross-section has been performed, and now the soft tissues en bloc will be reflected. In this way, the bony origin of the procerus muscle from the nasal bone can be appreciated here, and the bony origin of the corrugator muscle from the superciliary arch of the frontal bone can also be appreciated in this relationship. It has to be noted that the procerus muscle majorly influences the position of the medial eyebrow together with the frontalis muscle, whereas the corrugator muscle, located again here, substantially influences the mid portion of the eyebrow and the lateral portion of the eyebrow. Understanding this relationship, a high precision is necessary to target only one specific muscle, which means the muscle of desire, and to not affect other muscles in addition to this, which means to reduce collateral damage. A way to best perform this is, apart from knowing the underlying anatomy, to target their respective muscles with an intramuscular injection of each of the respective muscles. As the muscles of desire are located in the midline, slightly higher above paramedian, and slightly more superficially, more laterally located, a 5-point injection technique should be targeted. Identifying the procerus muscle at the nasal bone requires the target of the muscle at the nasal bone in contact with the bone to increase precision, as performed here. Targeting the corrugator muscle, approach also deep in contact with the bone to apply the product intramuscularly into the corrugator supercilii muscle can be performed like demonstrated here. In addition to this, and to affect the horizontal axis of movement of the glabella, which means moving the eyebrows medially, and the effect can cause some wrinkles or some bulging in the medial aspect of the glabella, a superficial injection can be envisioned here, which leaves with a total of 5 injection points for the glabella, which requires and can be administered with 20 units of toxin for targeting the entire glabella to achieve a very precise and a desired outcome. Upon reflection of the soft tissues again, the glabella can be appreciated. It's located here. And after the treatment, the respective muscles, procerus, corrugator, have been targeted with increased precision and with utilizing the benefits and the characteristic of the toxins, which has a reduced area of diffusion, which means a high precision to ultimately decrease collateral damage and to cause a superior outcome. Combining anatomical knowledge with an intramuscular injection technique, however, has to be paired with a precise product like Jeuveau to obtain desired aesthetic outcomes. Thank you very much for your attention.
Clinicians should consider their individual injection technique when implementing precise products like Jeuveau. An intramuscular injection with Jeuveau is recommended.
Glabellar. A 100-unit vial of Jeuveau has been reconstituted with 2.5 milliliters of sterile 0.9% sodium chloride. This will yield a reconstituted solution at a concentration of 4 units per 0.1 milliliter. The muscles targeted for treatment of the glabellar are the procerus, corrugator supercilii, and the depressor supercilii. Begin by having the patient animate by making a frown and observe the muscle movement for evaluating the injection sites. To avoid eyelid ptosis, place injection sites at least 1 centimeter above the bony orbital ridge. A 0.3 milliliter insulin syringe with a 5/16 inch 31 gauge needle is being used for increased unit accuracy. Cleanse the area thoroughly with alcohol and allow to dry. Inject a dose of 0.1 milliliter, equivalent to 4 units, deep intramuscularly into the inferomedial and superior middle of each corrugator and middle of the procerus muscle for a total dose of 20 units. Use care not to inject through the injection site markings. Due to skin and fascia thickness of this area, diligence must be taken to inject deeply into the procerus and head of the corrugator muscles. Additional units may be necessary depending upon varying muscle thickness among individuals and vary according to the treatment goal.
At launch, Evolus conducted the Jeuveau Experience Treatment Program, or JET for short. In this program, product was provided to practices to better understand healthcare professional and patient experience with Jeuveau through surveys. Please note that this program was different from the clinical studies that were conducted. When looking at the demographics in JET, 39% of patients who participated were under the age of 39, and 26% of patients who received Jeuveau had either never received a neurotoxin or had been at least 2 years since their last toxin treatment. This speaks to the product's ability to attract new patients into practices. Overall, over 5,000 accounts were enrolled in JET, and over 46,000 consumers participated in the surveys. Overall satisfaction with Jeuveau treatment was 94%, 83%, and 76% at days 30, 120, and 150 respectively. Likelihood to recommend to a friend or family member was 88%, 79%, and 72% respectively. What makes this data interesting is that the results here are based off injector and patient experience with Jeuveau. It's nice to see satisfaction results at day 150 that are similar to what was seen in the clinical trials. Additional feedback that was received during JET was an early onset of effect as well as natural-looking results with Jeuveau. Now that you have learned the science behind Jeuveau, we hope you are excited to introduce it into your aesthetic practice. Before we close, it is important to address the risks associated with Jeuveau, which are addressed more fully in the product prescribing information. As a reminder, botulinum toxin products, including Jeuveau, have a box warning related to distant spread of toxin effect, with symptoms such as swallowing and breathing difficulties that can be life-threatening and have been reported hours to weeks after injection. Jeuveau is contraindicated in patients with known hypersensitivity to any botulinum toxin product, as well as the presence of infection at the injection site. As noted in prior slides, due to product preparation and assay methods, units of botulinum toxin products, including Jeuveau, are not interchangeable and cannot be compared or converted. Note that unapproved use of botulinum toxin products can result in serious adverse reactions, particularly in patients with certain pre-existing conditions. The labeling for Jeuveau also includes warnings about the risk of serious hypersensitivity reactions with botulinum toxin products, as well as potential adverse events involving the cardiovascular system, such as arrhythmia and myocardial infarction. Patients with pre-existing neuromuscular disorders, such as myasthenia gravis or Lambert-Eaton syndrome, are at increased risk from treatment with botulinum toxins. These patients were excluded from the Jeuveau clinical studies. Treatment can result in swallowing and breathing difficulties, and patients with these conditions before treatment are more susceptible to complications. Immediate treatment may be required if these problems develop. Patients with pre-existing conditions at the site of injection should also be treated with caution. Warnings for Jeuveau also address potential ophthalmic risks, including dry eye, and theoretical risks related to human serum albumin and transmission of viral diseases. In clinical studies, the most common adverse reactions with Jeuveau were headache, eyelid ptosis, upper respiratory tract infection, and increased white blood cell count. Finally, there are insufficient data about the use of Jeuveau during pregnancy or breastfeeding, and safety and effectiveness in pediatric patients has not been established. For complete risk information for Jeuveau, please review the full prescribing information.
Thank you, everyone. I think those videos are great because they really just kind of are essentially 5 videos in one, and they just kind of give you everything you need to know, kind of 1-2 punch, and they're just so full of information. There's not a lot of fluff there. So hopefully you all appreciated that, and hopefully it was helpful to you. At this point, we're going to open it up for Q&A. And there's a little bit of a lag, so as far as when you put it into when I see it, about 15 seconds from when I understand. So feel free to ask me anything at this point. I see that through the chat, we got 1 or 2 questions. Before I get to that, I will add one thing that I think is a fun fact as we're kind of waiting for more questions to pop in. At the end, when we talk through your typical ISI, which is necessary, especially for a drug that's black box warning, and we understand that, by the way, that neurotoxins are used at much like 10x more even doses for treating medical conditions. So, in general, their profiles are really good, especially on the aesthetic side. But I think what's interesting that's mentioned is the number 1 complication is headache. But if you look at the studies in the placebo arms, the headache percentage was the same, but maybe slightly higher. And so when I talk to patients, I always remind them, you don't get a headache from the neurotoxin. It actually sometimes helps people's headaches. But in fact, you get some people get headache maybe about 10-15% because people just don't like needles stuck in their forehead. And that's really what's causing the headache. So I always find that a fun fact to tell patients. So here's some of the questions that have come in. What is the duration I should block for treatment? So I assume the question is coming from at least what's the duration during your office to treat a patient. In some level, it comes with experience, and some level it also comes with if this is a returning patient or a new patient. Typically, a new patient appointment for most clinics, and I'm in a lot of clinics, not my own, but in others, definitely see what good looks like. And typically 30 minutes is kind of where people start off with a new patient because they're demonstrating their needs and their effect, and then there's some assessment that goes on. But then once you get patients on a cadence and you really want to get them on a every 4-month cadence, and you can do that by actually pre-booking them before they walk out. It usually translates into a 15-minute appointment because at that point you're maintaining what you've already established. But I would say for a new patient, especially for someone who's starting out, 30 minutes is kind of the general. But it also depends on if they want just the glabella injected or if they're talking about other things. One other question I see that came in, how much is 100 units of the product? Do you mean what price-wise? I'm going to guess that we're talking about price. So as I mentioned kind of earlier, through this partnership with Henry Schein, we're offering a sample for people to try. And, you know, typically entry level for is in the 500, 600 range for a vial. But just based like anything else, kind of like shopping at Costco versus shopping in your grocery store, the more you buy, the lower the price point becomes. So $550 kind of typical entry cost for a vial, and then it starts dropping by kind of 25, 50 or so as you bulk buy or buy more frequently. Hopefully that answered your question, Whitney. Any other questions? Let's see a question about what are the benefits of adding Jeuveau to my practice? I think that, you know, everybody knows their practice a little bit better than I certainly do, but the benefit is obviously another offering to already a captive patient audience. Yeah, honestly, the learning curve for injecting neurotoxins is not high. There is though a learning curve. You just don't want to take like a day course and then start injecting people all of a sudden. But there is a learning curve. Most people start with their own office staff and then kind of move on from there. But the whole point is, you know, it's relatively quick. It's the patients are recurring. I think is, you know, as providers, we love the patients that keep coming back every, you know, 4 months or 6 months, year after year, and getting something done. So it's another revenue stream for you all. Let's see. I have another question here coming from Jeffrey. Given we're dentists, can you discuss the off-label use of bruxism? Yeah, I think there's a couple ways to answer that question, but or maybe the way you're asking. So bruxism has been very successfully treated with neurotoxins. Some of you may have experience with that, some of you not. And, you know, injecting the masseters, the temporalis muscle is becoming quite frequent for both functional and aesthetic purposes. You know, as I kind of alluded to before, and this is kind of where the heart of the question, I think, is, believe it or not, most injections, because you said off-label, Jeffrey, most toxin injections in this country, and I think other countries, are actually off-label. How? The reconstitution, people will do different things. They'll reconstitute with slightly different saline to decrease stinging. And then they'll certainly treat many different anatomic areas. So I think if the question is, can you do this off-label? Should dentists be comfortable with it? In the end, you're the providers. You have to make that decision. But I will tell you that it's done quite frequently with very high patient success rates. Hopefully that answered your question, Jeffrey. If it didn't, feel free to kind of do a follow-up to that. Have another question coming with Padma. So the question is, compare Xeomin cost to Jeuveau. So I'll answer that first by comparing efficacy. I think, you know, in the beginning of the video, you saw the neurotoxins compared to each other in basically the underlying molecule is the same, but there are inherent differences in manufacturing, accessory proteins, and so on. So I think as providers, number one thing that we all want is our patients to be happy, right? That I think is number one. Cost is obviously important, but to be honest with you, I think we all agree it's secondary, because if the patient's not happy and something was less expensive, it's going to end up being more expensive for us in the long run. So with that, when I think about, and I'll give you a little bit of background too. Prior to joining Evolus 2 years ago, I actually worked for MERS, who manufactures Xeomin. I think it's a good product, but I also, from my experience, do think our efficacy is superior. So that being said, really the costs are pretty comparable. Sometimes we might be less and sometimes we might be more, but it's really right around the same range, to be honest with you. So I would say cost shouldn't be really a factor there. It's really, what are you comfortable with? And I think there's also a different question sometimes that comes from providers who are already using Botox, because we know it's much more expensive. Why is it more expensive? It's because Botox cosmetic is only a third of Allergan's toxin business. 2/3 is on the medical side. And because they're tied to the medical side and the reimbursement, their price is always going to be higher and less flexible. And so when you're talking to patients, it's actually a much easier discussion to talk to them about a conversion from Botox to Jeuveau than Botox to anything else, because they're the most similar. Hopefully that answered your question, Patty. We got another question. I love a little questions, so keep them coming. And then another question from Jeffrey again. Crow's feet, limited musculature, but very needle or go off angle. Okay, I think I know what you're talking about there. So I'll just state it here. This is an off-label question, which a couple other ones have been, but I think you all know that, especially how I prefaced it, which is fine. You're allowed to ask it, and therefore I can answer it. So in the crow's feet, you're injecting the lateral orbicularis. The orbicularis is a circular muscle. It closes your eye. It's opposite to the levator, which opens your eye, and somewhat the frontalis, which pulls up your eye as well, too, by lifting the brows. When you inject the crow's feet, they're laterally. So typical dosing, by the way, is about 12.5 units per side. And when you inject, the muscle is so superficial, you can either inject just submuscular. I wouldn't make a bleb. I would go just to the skin. Or honestly, you can go on bone, because there's just really not much else there except skin, a little bit of sub-Q fat, and then muscle, and then bone. So you almost can't go wrong in how you inject the crow's feet. Let's see, other questions is great. Would this product be more similar to Botox or Dysport? Okay, good question, Tammy. So it's definitely much more similar to Botox. Let me tell you an interesting story too. In the company, when we launched 3 years ago, a bit before my time, but it was the right thing to do then, because we really didn't have the information. When the product launched, we did say use it just like Botox, right? We thought it was very close. You could see that in the clinical trials on the glabella, which is the way everyone gets their first indication of approval into the FDA because the FDA knows it. And so it looked like how we acted was very similar to Botox, and actually maybe a little bit better. And so the party line was use it like Botox. Some people were really happy with the outcome, and some people are like, it doesn't work quite as well. Interesting, Dysport had a very similar story 10 years ago. I experienced that myself. People would say when Dysport was launched, I asked, how do I use it? They said, use it just like Botox. It actually diffused a lot, gave people brow ptosis, lid ptosis. No one uses Dysport the same way. It just has a higher diffusion profile. And let me give you a caveat on Xeomin, Dysport, Botox. They're all great. They're all great drugs. This is just such a good class of drugs, but they all have their nuances and they all have their place. And so to answer your question, it's much more similar to Botox. It has some nuanced difference in the fact that it probably spreads a little bit less. It's a bit more precise. That's been alluded to a couple places. But, to be honest with you, those patients are the ones you can convert from Botox to Jeuveau. It's a bit harder from Dysport to Jeuveau because the units are different in Dysport, while Botox and Jeuveau are very similar units. And honestly, almost how you inject it is very similar, but not exactly the same. And then Tammy had another follow-up question. The reason I'm asking is due to patients getting tolerant. Oh, okay. That's a good question too. So I kind of went off on a different angle of it, but so Tammy said, the reason I'm asking is due to patients getting tolerant to Dysport and or Botox. So really what happens, and so when someone, by the way, has a reaction to a toxin, they're not usually having a reaction to the toxin. It's actually very rare. They're usually having a reaction to the human serum albumin that's in the formulation for all toxins, but even that's not common, and it's not usually a significant reaction. That being said, when people are becoming tolerant, it's essentially they're potentially are creating antibodies to the toxin. We have never had in our formulation that we have now, which is the vacuum dried formulation, any neutralizing antibodies against the toxin. And really the thought process is we have a very good manufacturing and filtering process. And really it's very well known that every vial has a certain amount of denatured protein, and denatured protein is what people are more reactive to. So switching someone from Dysport or Botox, while I can't say it's going to definitely work better, is something good to try if you feel like the patient's becoming tolerant of it. But that could be dose creep too, meaning that the patient's getting older, they've gotten Dysport or Botox for quite some time, and they just need more units because now they've been on it for 10 years and they're still doing the same amount of dosing they've been doing, throughout. So it could be one of those two things, but switching into a different toxin is something reasonable to try for sure. Let's see. We have Steven. Do you have 50 unit vial and do you sell 0.9 normal saline? I know why you're asking about the normal saline. I'm not laughing, but it's sad. There's a saline shortage. I'm sure everybody's somewhat aware of this. I kind of always stock up on saline personally because it's cheap to buy, but the companies that make it also, they don't make a lot off of it. So if there's manufacturing strains, it's kind of the last thing that they put effort into. So no, unfortunately, we don't sell saline. That would actually be Henry Schein. They have much more access to, because to be honest with you, buying saline is the companies will sell it in the most bulk as possible, right? So the different manufacturers of saline, Henry Schein has the most buying power probably of anybody. And then, of course, how do they distribute to you all? That's a whole different story. But no, we don't sell saline, and I appreciate that there's unfortunately a shortage that comes and goes. So my suggestion is buy a lot of it when you can, and the shelf life is usually a couple years, and just keep it there. As far as the 50 unit vial, interesting enough, we have it in Europe, but we don't have it in the US. There's a couple reasons for it, but one thing to kind of keep in mind, and I think some states may be a little bit more conservative than others, the 100 unit vial is much more price beneficial than a 50 unit vial, and it hasn't really been an issue for us at all. What I see from the other companies, the only time they use their 50 unit vials is just honestly as promo vials. But I didn't really actively sell those, at least not in the US. Tim's got a question. Can I use Hank's Balance solution to reconstitute Jeuveau instead of 0.9 saline? I don't know what Hank's Balance solution is, but if that's bacteriostatic water, then unfortunately not. I think if you're asking me the question, if someone wants to ask me the question, where do you get saline? I will tell you that people are looking at it for different sources. You can go on the FDA website. They do talk about manufacturers that have it actively. Speak to your colleagues, but I really can't go out and endorse some of the things that some individuals are doing, because to be honest with you, some people are using bacteriostatic water. The osmolarity of that is completely different. You really want to use saline, whether it's preservative-free, which is on label, or bacteriostatic, which is honestly what most people do. But definitely be weary of these other solutions. Like, I don't know what Hanks is specifically, but I would look it up. If it's not saline, then don't use it. All right. Well, I think, Corinne, that actually was a really good Q&A. I'm glad to get those questions. I think if there's nothing further, we're basically at the end of the hour. Are you okay with wrapping up, Corinne? Does that sound good?
Yeah, absolutely. Absolutely. So thank you, Doctor, for the information this evening. And thank you to everyone for attending and the great engagement tonight. We had a great Q&A session, so thank you for that. As a reminder, if you would like to request a complimentary sample of Jeuveau, please click on the Request a Sample widget. It will actually be highlighted on your screen shortly. We also did record tonight's webinar, and we'll be emailing the recording out sometime in the next week. If you are interested in attending future webinars, please visit www.henryscheindental.com/webinars. And lastly, we would appreciate your feedback via our survey that will pop up on your screen shortly after the webinar. Thank you all for joining us, and we look forward to seeing you on future webinars. Thanks again, Doctor.
Thank you, Corinne. Thank you all. Have a good evening.